statins are great drugs that have been proven to be very effective in lowering cholesterol and in improving clinical outcomes. By that I mean reducing heart attacks, the need for bypass surgery, in some cases mortality as well. Mm-hmm. And they work by affecting cholesterol metabolism in the liver and decreasing the hepatic production of cholesterol.
Now, does this have any long-term impact on any of the other organs of the body, like, say, the liver or the gallbladder?
There was a concern about impaired liver function with any of the statins, but that's a very, very uncommon situation. It can occur. There are muscle side effects that can be nuisance type effects, or that can be really significant,
right?
And lead to fortunately it's not common, but it can lead to muscle weakness that is quite symptomatic. There's no magic bullet,
right?
So clearly the most effective drug for lowering cholesterol and improving outcomes in people with coronary disease are the statins. Niaspan or niacin is an HDL raising medication.
Right.
It also lowers triglycerides modestly, but it's probably the most potent drug for increasing HDL.
Side effects?
The most common is flushing,
right?
Skin flushing, to the point where it's very difficult to take, but there are ways to get around that, people who need it.
Do you believe that coronary artery disease can be reversed?
I do.
And why do you believe that?
Well, there have been a number of trials with cardiac catheterization, with intracoronary ultrasound that have documented regression of plaque with successful LDL lowering therapy, I should say that.
If muscle in the heart is dead, can it ever be revived in any way?
No.
So,
scar tissue is scar tissue, and that's not going to get better.
So
but the thing is, the heart has a tremendous reserve capacity, so that it can take a pretty big hit and still allow you to function fairly normally.
Would you say, for example, that, just so our viewers know what I'm talking about, I want to talk about ejection fraction. Can you talk about what the ejection fraction is for a second?
Sure. The ejection fraction is the amount of blood that is ejected from the heart with each beat, and basically it's the change in the volume of the heart from when the heart fills with blood to where it is at its smallest point.
Right.
So that fractional change in volume or size is the ejection fraction.
My question is, in terms of just curing heart disease, not curing it, but getting over it, I guess, and improving, is it ever possible to get the ejection fraction to improve following an event?
If you're lucky to have your issues addressed quickly and effectively, then a lot of times things do improve. There are people who have had extensive heart attacks or who have had recurrent heart attacks and have severely scarred heart muscle that does not get better. One of the key cornerstones of treating vascular disease is therapeutic lifestyle changes, through diet and eating the right foods. There's a lot of controversy as to what constitutes eating the right foods. And
sure. It's confusing because the government says one thing. There's the Miami Beach diet and somebody else's diet. Some people say eat a lot of grains. Other people say, no, grains poison. Eat a lot of meat. Some people say eat fish. What should you be doing? What do you in your own opinion?
Well, I'll give you my opinion.
Right.
Unfortunately, I think the issue is not going to be resolved because there's never going to be a study that will conclusively show that one dietary intervention or one diet is without question better than another diet. So I think that you need to research the what you do, what you decide to do, and determine what's best for you personally. Again, as we've discussed, I think that the best approach is through eating to minimizing meat intake and maximizing vegetables and plant-based foods.
There's what's best for the patient, and then what the patient is willing to do and
Correct.
can practically do.
Right.
Because our country is not really built for a plant-based diet. There's just too many other temptations out there, and you may be talking about somebody changing habits that have been built up over a lifetime.
Right, and I realize it's very difficult. That's why, you need to do the legwork to understand why it's important, and you need to believe that it's going to make a difference. Because if you don't believe it, there's no way in the world that given all the habits that have developed in most of us over the course of their lifetime, it's very, very difficult to change. A vegan diet is significantly less calorie dense than the standard Western civilization diet.
So that's two advantages you're going to have. Number one, no cholesterol going into your body, except for what your body produces. And number two, the likelihood of you losing weight is, it's very high.
Right.
If you can stick to this kind of a diet.
Right, and the other major thing that you take in with a plant-based diet is a tremendously higher amount of fiber.